My name is Greg Abrahamian. I'm the surgical director of the Adult and Pediatric Kidney Transplant Program. I went to medical school at the University of Texas Health Science Center in San Antonio, did my residency with the Air Force in general surgery at Wilford Hall Medical Center, and I did my transplant fellowship at the Massachusetts General Hospital. I served 23 years in the Air Force as a transplant surgeon and eventually joined the staff here in 2000. My desire to become a surgeon probably started well before I went into medical school. Some of that had to do with spending a lot of time watching MASH with my dad, others accompanying my grandfather to the hospital. Whatever event it was, it always seemed that medicine was going to be in my future. I started my general surgery residency in 1992, completed that in 1997, and then completed my organ transplant fellowship in 1999. So I've been a staff transplant surgeon since 1999. The patient interaction is what I enjoy the most. The unique thing about transplantation versus many of the other medical specialties is once we develop a relationship with the patient, we usually will interact with that patient for the life of their transplant. So we get to know them very well, and we are able to follow their progress for a number of years and see the successes. That's probably the most gratifying part, is the long-term doctor-patient relationship we have. My interests and hobbies are what my daughter's interests and hobbies are. Right now that's gymnastics, horse jumping, and more recently, skateboarding. I was a California skate punk, so I'm back to skateboarding. All the transplants I perform are gratifying, either be it kidney or liver, but some of the most gratifying are the pediatric transplants that we perform. And we've performed transplants on kids as young as 9 months old. They're very challenging, as you can imagine, operating on such a small baby, but the biggest gratification is watching that baby grow up. And I've had that opportunity a number of times to watch a child that we operated on or transplanted when they were months old to their teens, and how well they've done and survived. And those are probably some of the most gratifying transplants.